cardiac ICU is quite different from those other ICUs. It has very many equipments that are needed for patients' receival. Secondly, in ICU itself, it has to have all mounted gadgets like a monitor, a cardiac monitor, that has all the modes that are able to monitor the patient so closely. It has to have different cables that have to be put in different ports so that they can monitor the patient's vital signs as required. Secondly, you have to have the oxygen ready. So in a cardiac ICU, we usually have 2 oxygen ports because if one runs out, another one is used. Secondly, the oxygen ports we have to have many because the ventilators also use oxygen. We also have to have 2 vacuum ports. We use one for low suction and we use another one for high suction. You also have to have the arm bag with you ready because before the anesthesiologist comes in to intubate the patient, you have to already be doing something like emergency compressions and taking care of the airway. You also have to have the laryngoscope set ready with you, and you also have to prepare the ETTs because when the patient comes out, it is you, the intensive care nurse, to know that this patient has been used, such and such an ETT tube has been used on the patient, so that you also prepare them by your bedside in case of any self-extubation or to remove that tube that helps the patient to breathe from the ventilator. You have to quickly intubate the patient.